Okay, today we will talk about perineal care. So before your return demo, I will discuss to you uh, how to do it, and later we will have a video presentation of perineal care. Okay. The purpose of perineal care is to remove the normal perineal secretions and odor to promote clients' comfort. So in perineal care, before doing any procedure, you need to check the identification of the patient. So what is the rationale why you need to check the identification? Of course, to know if you are doing the procedure to the right patient, on how you will do the checking of identification. Of course, to check the two identifiers. For example, the patient complete name and the age of the patient, or if there is a patient medical number on the ID band, you can also check that one. The next one is explain the procedure to the patient and assess any discomfort. Of course, before doing any procedure, it is very important to discuss first what is the procedure all about, how the procedure will help the patient, so that you will so that the patient will cooperate with you, or if the patient agree for the procedure, that's the time also you can also explain. Okay, the third one is to gather necessary equipment and materials. So what is the rationale for preparing the equipments before doing any procedure? Of course, if you will prepare your equipment, you will save your time and you will save your energy. And then number 4, check for the MDs ordered or as indicated. Of course, it is very important before doing any procedure to read the doctor's order, so that you know if the doctors have special orders, or for example, after perineal care, the doctor's order for application of any medications, or the doctor's order for what solution you will use in perineal care. So it is very important to check the doctor's order. So what's next? So the next one is to provide, ensure privacy. Okay. In doing perineal care, it is very important to provide a privacy. So why? What is the rationale? Because it is the private part of your patient. So it's always, it is very vital to check, to provide and make sure that the patients, you have provide the patient privacy. How you will do it? Check the door first. If the door is closed, then check also if the curtain is closed, and also you need only to expose those area that you need to do the procedure or you need to clean. The next one is position the patient comfortably. Of course, in doing any procedure to the patient, it is very important for us nurses to check if the patient is comfortable while we are doing the procedure. And then number 7, prepare discarding bin, bag as necessary in the working area. Of course, sometimes when you are cleaning the perineal area of your patient, of course, there is some secretions like that is mainly. So, right away, if you will use a cotton, because in perineal care, you can use a washcloth or you can use a cotton. And every stroke, you need to throw it. So, of course, it's considered infectious because there is some secretions, there is some mucus inside the cotton or the washcloth. You need to dispose it right away. So, it is better for you to have a bin at or trash can at your side while you are doing the procedure. And it depends also in the hospital protocol on how you will throw it. And in the some hospital, for those infectious or cottons, use towels, use washcloth. They are using a yellow bin. So it's depend on the protocol on the hospital. So the next is performance is hand hygiene to perform the hand hygiene. So why it is important for us to do the hand hygiene in doing any procedure? Of course, to prevent the growth of microorganism. So there is a five moments in 5 moments of hand hygiene. So what is the 5 moments of hand hygiene? So during the return demo, it is important that you have mentioned the 5 moments of hand hygiene. So number 1, before touching the patient. Number 2, before clean or aseptic procedure. Number 3 is after body fluid exposure. And then number 4, after touching the patient. Number 5, after touching the patient's surrounding. So always remember the 5 moments of hand hygiene in doing any nursing procedure. So what's next? Okay, this is the review of a female reproductive system. So this is the mons pubis, clitoris, labia majora, labia minora, perineum, anus, urethral opening, and the vaginal opening. Okay, guys. Before doing any nursing procedure or before doing the return demo, it is very important to remember the 4 things. If you fail to do the 4 things, you will repeat the whole scenario. You will repeat the return demo. It is very important first to identify the patient, check the ID band. Of course, it is very important that you are checking the correct name of the patient because you might do that one in the wrong patient, so you are totally wrong. Next one is check for the privacy of the patient. It is very important, especially in perineal care. And next is the comfort of the patient. And the last one is the hand hygiene and the 5 moments of hand hygiene. So it will be very important for you to mention that one during your return demo. Okay. So during the procedure, female Peri-care. So as a student, you should demonstrate the following. So number 1, raise the bed in comfortable height. Of course, what is the rationale? Why you need to put the bed in the comfortable height? Of course, if you are working, if you are doing any procedure to prevent the backache, you need to level the bed in your comfortable height, like in your waistline, so that you can easily work and you will prevent the backache. Then after that, you will wear your gloves. Then the next one is prepare the patient. So how you will prepare the patient? So you need to unfold the linen going to the foot of the bed. And then, if you are alone, you can use the side rails. But if you have assistance, you can ask assistance before applying of the waterproof pads. So, you can call your colleagues to assist you. So, your colleagues will be in the other side and you are in the other side. So why it is important to ask assistance, especially when you are doing the perineal care? Most of the patient who is having perineal care is adult patient. So there have the maybe the patient has a weak body part and they are risk for fall down. So make sure always make sure the safety of the patient if you are doing any procedure. So if you want the patient to turn to left side, right side, always ask assistance. If you don't have assistance, always make sure that your side rails is up. Okay, the next one is expose the patient and make sure the privacy. So this is what I have mentioned a while ago. So once you expose the patient, make sure that the exposed area is the one you are doing the procedure only, not all the body parts of the patient will be exposed. And then position and lying back with flexed knee or spread apart. So it will be a dorsal recumbent position. So next, okay. So if you will start cleaning the patient, you can use a cotton. So for the cotton, you can use a seven stroke. You can use the cotton. For every stroke, you can throw the cotton. But for our video presentation, there is a washcloth. There are two procedure or two method in using the washcloth. So for example, this is the washcloth. So in washcloth, there is two method. One is met method. So yung met method, you will just fold. For example, this is the one. This is the washcloth. You will fold it like this. So ayan. You will just fold it and then like that. So, pwede mo na siyang, you can use this to wipe, to do the stroke in cleaning the perineal area. But on the other side, the other usually they are most commonly used is the four square method. So, for the four square method, you will just fold it into four sides. So, one and two. Then you will see there is a four layer. 1, 2, 3, 4. Okay, 1, 2, 3, 4. So it will be like that. So per layer, you can put a liquid soap. So depends on the doctor's order. For sometimes if we are using the cottons, the doctor's order betadine. For the other patient, there is a soap solution. You can use a washcloth and then put it in every layer. And then for every layer, you can wipe the perineal area. And then, again, for every stroke, other side of the washcloth. And then, you can discard the washcloth right away. So, for four square method, put the soap in every layer and then wash the area from top to bottom. So, from top to bottom, you will just wipe or do the stroke. Then, it will be side to side or in the middle. So, in the middle, you will see a labia. So, you will just open it and then separate it. And then, you will do a stroke or wipe from top to bottom. And then you can discard again the washcloth. So later we have a video with that procedure so that it will be more clear to you. Next one is for the rinse, same method as washcloth. So imagine, just imagine what you are doing in the first method when you are doing the washing with the soap. Just same procedure when you are rinsing the patient. And then after you rinse the patient, do the pat dry. If you're doing the pat dry, there's no particular order or sequence in doing the pat dry. As long as you are doing the pat dry in all the area, and then until the area become dry. And then after that, you will throw again the washcloth and then cover the patient. And then ask again a assistance, or if you don't have assistance, you can use the side rails. And then clean the back. At the same technique, same stroke. So in a wash technique, you will use again the washcloth. Then from the vagina going to the rectum. So you will wipe from vagina going to the rectum. You are putting a soap. In every layer also, you will put a soap. And then in every layer, you will do a stroke in the perineal area. And then after that, you will rinse with same procedure. So there is a video also again for that so that it will be more clear to you. So for the pat dry and cover the patient, face the patient towards you and flex the knee and the shoulder. And then remove the waterproof pads by rolling the pads and contain solage and dispose the pads and dispose the waterproof pads. Okay. Next one is cover the patient, place comfortably and lower the bed. And then clean the bedside and the equipment according to the hospital protocol. So for the last one, remove the gloves, do your hand washing again, and then document, record the kind of procedure that you have done, and then record the permanent observation and patient response to the procedure. Okay. So after this discussion, I will play a video so that you will easily understand and you will uh, see how to do it. Okay. I will play a video.
Hi, Mrs. Perry. It's Vicki, your CNA, and I'm here to do female Peri-care. I'm going to sanitize my hands. I'm going to gather my equipment, Mrs. Perry, and then I will be right back and we'll get started. Covering all surfaces until completely dry. Six washcloths, waterproof pad, pair of gloves, and a basin and soap. And I will also need my laundry basket. I'm gonna get my comfortably warm water. I'll be right back. Get my comfortably warm water. I'm going to get it from the warm side, not too hot, but it does need to be warm. Okay, I only need about 3 cups of water or so, and headed back. I have my comfortably warm water here. Okay. I'm going to pull the privacy curtain. That is a molded item, and it's a key step, so if it's not done for female Peri-care, then it is an automatic fail. So I'm going to go ahead and pull my privacy curtain as far as my test observer wants me to. So I'm pulling my privacy curtain. I am going to raise the bed. All right, we're going to get started, Mrs. Perry. Raising the bed to comfortably working height. Generally, that's about the waist level. Okay. All right. I'm going to put on my gloves. And while I'm putting on my gloves, just a side note, barrier towel is optional. If you want to put a barrier towel, that's absolutely fine. It is not in the skill book for the state board, so it's not required. But if you would like to put one down, it's certainly acceptable, and it's acceptable. You won't lose any points. You won't get any extra points, but you're welcome to do so. I'm going to leave without. I'm going to proceed without the barrier towel. All right, I'm going to put my sheets down to the foot of the bed. And this time I'm going to ask my test observer to step over to the other side of the bed, please, so I can apply my waterproof pad. Okay. All right, Mrs. Peri, I'm going to turn you over. Mrs. Observer, if you can hold her. Thank you. I'm going to apply my waterproof pad now. It doesn't matter which way it goes, long ways or vertical or horizontal, it doesn't matter. Roll it up and just tuck it underneath. All right. Thank you, test observer. The test observer will hold a mannequin for you. You don't have to ask. They will do that to help you out. At this point, I can expose my mannequin. I've already pulled the privacy curtain, and I can expose the mannequin by raising the gown to the waist level. I'm going to get started. I'm going to use a washcloth in the 4 square method. Now you can use the mitt if you'd like. However, it's more difficult to use that way to prepare it. You can use the mitt if you'd like. However, we prefer and we advise you to use the 4 square method here at ANTI. So you have the washcloth, and then you half it again, so you have 4 squares. So you need to put soap on all 4 sections of the washcloth. So here we go. A little bit of soap there on the first side, and then soap on the second, third, and fourth corner of the washcloth. All right, I'm ready to start. I'm gonna start on one side with the clean portion of the washcloth, get another clean portion of the washcloth, clean on the other side, and then with the third portion of the washcloth, separating the labia from top to bottom. Each stroke is from top to bottom. And then I'm disposing my washcloth. I don't put soap in my water because I need rinse. Again, we need to wash well so it doesn't drip. Now this is my rinse. Again, 4 square method, just to show you. Washcloth, half, and then square. Again, clean portion of the washcloth for every stroke, using the corner. You rinse the side, doesn't matter left or right first. Clean portion of the washcloth, the other side, and the third side, separating the labia top to bottom. All strokes must be top to bottom. Disposing of my washcloth. Now, is my pack dry? It doesn't matter the order in which you dry, just as long as you dry. Dispose of that. Cover the mannequin. Test observer, would you stand on the opposite side? I'm going to turn Mrs. Peri. All right, Mrs. Peri, I'm going to go ahead and turn you. The test observer will hold the mannequin. You don't have to ask them. They'll do that to help you out. Same technique in the back. Washcloth, 4 squares, using a clean portion of the washcloth for each stroke. Doesn't say on the state board how many strokes, but we just recommend 3. Again, putting soap on each corner of the washcloth, and we will do 3. Here we go. Starting from vagina towards rectum. 1, clean portion of the washcloth for each stroke. 2, so that's the side, and then 3. So it's middle, side, and side, and it doesn't matter the order on the back, as long as you go from vagina to rectum. That's the wash. Same technique for the rinse, 4 squares. No soap on this one. Clean portion of the washcloth for every stroke. side, side, and middle. Again, from vagina to rectum, every stroke. Dispose of my washcloth. Now I pat dry. No specific order or sequence for drying, just pat dry. Cover my mannequin. Get rid of my waterproof pad. Thank you, test observer. Bring the mannequin towards me, folding the knee, grabbing at the shoulder, rolling to contain the soilage. Dispose of my waterproof pad. All right, Mrs. Peri, we are done. I'm going to lower the bed, and then I'm going to get rid of my supplies and clean up. Lowering the bed. All right, Mrs. Peri, I'm going to clean up, and here's your towel light and water within reach. I'm going to clean up, and I'll be back to check on you, finish up. And dispose of my water and rinse my basin. It's not, you don't have to wash the basin with soap, just simply rinse it with water. Doesn't matter if it's warm water or cold water, just rinse it. Thoroughly dry the basin. Put that aside. Remove your gloves. Dispose of your gloves in the trash can. And at this point, this is where we begin to wash hands. If you have anything that's obstructing your wrist, a watch, or anything else, you need to remove it or raise it so that your wrists are free so you can wash those too, which is part of the skill. I'm going to turn on the water. It doesn't matter whether it's warm water or cold water as long as you turn on the water. Okay. Wet your hands. Generous amount of soap. And you wash for 20 seconds, interlacing the fingers. Fingers pointed downward, washing the wrists, both sides, 20 seconds. You can say the alphabet or sing happy birthday 2 times, or just watch, time it on your watch, whichever you'd like to do. You can take your watch off, put it on the countertop if you'd like, and monitor the 20 seconds that way, but it has to be a minimum of 20 seconds. Wash. Scrubbing your palms, interlacing the fingers. Alright, and this is where we rinse. It's 20 seconds. There's no particular way or order for rinsing, just rinse. As long as you don't touch the sink. And if you do touch the sink, you just start all over again. Just tell the test observer you need to restart. So rinse your hands thoroughly and your wrists. Gotta leave the water running. I know it's difficult to let it run. You've gotta leave it running while you're drying your hands thoroughly. Okay, once your hands are thoroughly dried, it doesn't matter how many paper towels you use, as long as it's thoroughly dried. You use a clean, dry paper towel, not a wet one, to close the faucet and dispose of the paper towel. Right, now that I'm done washing my hands and rinsing and drying my basin, I'm going to put my supplies away, back to storage. And once again, my call light water is within reach. I've already lowered the bed before I walked away. I'm going to open the privacy curtain, and Mrs. Peri, we are done. Call if you need anything. Task complete.
So that's the video presentation of female perineal care. And then the next one is the male Peri-care. So this is the illustration of a male Peri-care. So this is the scrotum, testes, then the foreskin, penis, urethra, sperm duct, and then the prostate glands and the bladder. So during the male peri-care, so you will do already the identification of the patient, you will explain the procedure, and then you will do hand washing, and then after that, you will proceed for the procedure of male peri-care. So you will raise you will raise the bed in the comfortable height, or waist level, and then don a clean gloves, and then prepare the patient, so fold the linen to the foot of the bed and ask assistance, or you can use the side rails if you are alone, and then apply the waterproof pads. So the next procedure would be expose the patient expose the patient above the waist, and then remove the diaper by lifting the hips and dispose the diaper. So class, the video presentation, the patient is wearing a diaper. So it will be a optional if we have the diaper during the return demo, we can remove the diaper, but if not, we will just do the male peri-care. Okay? So for the wash, use a washcloth with 4 square method. Apply a soap in every layer. So this is the one I have explained already. Same method with the female peri-care. So for the first stroke, start with the end of the penis in a circular motion. And then for the second stroke, start with the shaft downward. And then for the third stroke, it's the same. It's up to you how many times you will do it. And for the last portion of the washcloth, you can clean the scrotum area and then dispose the washcloth. Then for the next one, for the rinse, it's the same method. So you will rinse it. You will use again your washcloth. You can put a water, and then use the same procedure with the 4 square method, and then um, again use the for every stroke, you will do the cleaning and then dispose the washcloth. Okay, for the rinse, same method. And then after rinsing, pat dry. In any order, you can do the pat dry and then dispose the washcloth and cover the patient. And then after that, as assistance, or if you are alone working, you can use the side rails. And then clean the back of the clean the back with the same technique. So you will ask the patient to turn to clean the back, and then during the washing, you can use the same method with 4 square method. You can apply the soap in every layer and then clean it starting from the scrotum backward. So scrotum backward. So side to side, middle, it's up to you. There's no proper sequence as long as from scrotum backward. And then rinse using the washcloth with the same procedure. Okay, next. Pat dry and cover the patient. Face the patient towards you and then flex the knee and the shoulder. And then remove again the waterproof pad. Same with the female procedure. Roll to contain the soilage. And then make sure that you will throw the waterproof pads in it depends on the hospital protocol. So next one is cover the patient comfortably and then lower the bed. And then, clean the bedside and discard all the disposable equipment according to the hospital protocol. And then remove the gloves, then do the hand washing. Same with the female procedure, it is very important to do the documentation. So in doing the documentation, kindly record the procedure that you have done, and then record what you have observed on the patient for the odor, for the secretion, color of the discharges, and then if there is any irritation on the part of the patient penis. Also, you can write down and then inform the doctor. So, next one. Okay, for the next one, we will do another video presentation.
Hi, Mr. Jones. My name is Vicki. I'm going to be your CNA today, and I'm here to give you male Peri-care and change your soil brief. I'm going to gather my supplies, and I'll be right with you. Sanitize my hands. And I'm going to gather my equipment. Pair of gloves, a brief, a bag, and a pen. A waterproof pad, and I'm going to need a basin with comfortably warm water. Get my comfortably warm water from the warm water side. Make sure it's comfortably warm, not too hot. Warm. I only need about 3 cups or so, 2 cups. All right, Mr. Jones, I'm here with my comfortably warm water, and we're going to go ahead and get started. I'm going to pull the privacy curtain. As far as the test observer tells me I need to pull it, I'm going to raise the bed to comfortable level. Okay. All right, Mr. Jones, we're going to go ahead and get started. I'm going to put my gloves on. I've already pulled the privacy curtain and sanitized my hands. I'm going to go ahead and uncover you. Get this done by uncovering you. May I have my test observer on the other side, please? Okay, I'm going to put the water pad on. Pour them. Come back, Mr. Jones. Test observer, come back so I can finish unrolling this. Thank you, test observer. All right, Mr. Jones, we're going to go ahead and lift your gown up just above your waist here and remove your brief, top to bottom, side. Hips. Take my bag. Put the soil brief in the bag. Find the bag. Put the dirty brief in it and putting it in the garbage can. I'm going to use a washcloth, and this is just plain water. We're not going to put soap in the water because we don't want soapy water. Okay, so you can use the 4-square method, which is what we recommend at AMTI, half, and then in quarters, or you can use the mitt. The mitt is more difficult to use. That's why we recommend the square method. So let's go back to the square method. All right, so I'm going to put soap on a clean portion of the washcloth, 4 areas. 1, 2, 3, and 4. So I have soap on all my areas. Okay, so starting at the end of the penis in circular motion, using a clean portion of the washcloth for every stroke, circular motion. Peel back and get a clean portion of the washcloth again, starting from the shaft downward, and now another clean portion of the washcloth, shaft downward, and now your last portion of the washcloth, you clean the scrotum. Dispose of that. In the same method, we're going to do the rinse. Again, all you want is plain water. Wring your washcloth pretty well so it doesn't leak all over the place. Same thing. Okay, in circular motion, from the end of the penis circular, clean portion of the washcloth, rinse downward, from the shaft downward, clean portion of the washcloth, shaft downward, and then clean portion of the washcloth, rinse the scrotum. Get rid of that washcloth. And then we take a clean washcloth and we just pat dry. No particular order for patting dry, just pat dry the area. Dispose of that. Okay, covering the mannequin, and I'm ready for my test observer on the other side of the bed. Okay, Mr. Jones, we're going to go ahead and turn you now. Thank you. Exposing the perineum, and the same order as in the back. Again, squared washcloth, wring it out well so it's not dripping all over the place. Clean portion of the washcloth for each stroke, so you want to get one area, soap again in each corner, soap again, and soap again. All right. Okay, so starting from the scrotum away. 1, 2, clean portion of the washcloth for every stroke, 3, and 4. Doesn't say how many, just says for each stroke, clean portion of the washcloth. We just say just do all the corners, all 4 corners. In the same fashion, you're going to rinse. Again, wringing out your washcloth well. Clean portion of the washcloth for every stroke. Starting at the scrotum backwards. 1, 2, 3, and 4. No particular order, just from the scrotum backwards for stroke, using a clean portion of the washcloth for every stroke. And lastly, we pat dry. No particular order, just pat dry. Okay. Now I'm going to take my new brief. I'm going to date it and time it, and my initials. 02 15/16. It's 10 a.m. and my initials. Okay. Remove the waterproof pad first. Size up the brief. Thank you, test observer. All right, Mr. Jones, come on over towards me. We're almost done. contain the soilage, put it in the laundry basket. Okay. Finish putting on the brief. Fasten it on both sides. All right, Mr. Jones, you've done well. We're almost done. And we cover him up. The name, the date, the initials, the date, and the time are written on the brief. It doesn't matter where it's applied on the brief as long as it is written on the brief. I'm going to cover up Mr. Jones. All right, Mr. Jones, we're going to lower the bed, and I'm going to get rid of my supplies. And wash my hands. Okay. Here's your call light and water within reach, and I will be back after I cleanse my container. Dispose the water. Rinse it. Just rinse with water. It doesn't require washing it with soap or anything. It's just a rinse. Dry it thoroughly. With a paper towel is fine. Remove my gloves. All right, I'm going to go ahead and wash my hands now that I emptied, rinsed, and dried my bucket. If I'm wearing a watch, I need to remove the watch or raise it up high enough so that I can have access to both my wrists because that's part of the hand washing skill. Turn on the water. Wet my hands. It doesn't have to be hot water. It doesn't have to be warm. Either one will be fine. Grab some soap, generous amount. Fingers pointed downward and interlacing the fingers, and 20 seconds. It's a real 20 seconds at least is the hand washing time. You can wash more than 20 seconds, but 20 seconds is the minimum. You can count 1 1,000, 2 1,000, or twinkle twinkle little star times 2, or the alphabet. You could say the alphabet, but it's 20 seconds. Scrubbing the palms on both sides, interlacing the fingers, washing the wrists, and that's 20 seconds there. Rinsing, there's no particular order for rinsing. You just rinse, making sure not to touch the inside of the sink and recontaminate your hands. Okay, now I'm going to dry. I know that it's difficult to leave the water running, but you have to leave the water run until you're ready to close it correctly. Drying the hands. And now with a clean, dry paper towel, that's important, it has to be a clean, dry paper towel. And I dispose of that paper towel in the trash. I don't use it to dry the countertop or open the door or anything else. I just dispose of it. Come back to Mr. Jones. I am done, and I've already left you with your call light and water. Can I get you anything else? No? Okay. We'll call if you need anything. I put away my supplies. Task completed.
Okay, thank you very much. That ends my video presentation. So see you on face to face, and I will send to you this video and then the checklist. Okay, good luck and God bless. Thank you very much, class.